Welcome to the fourth module in the Visionary Board Leadership Program. My name is Shannon Studden, and I'm a Senior Program Specialist with the National Rural Health Resource Center, a national nonprofit organization dedicated to improving and sustaining the health of rural communities. So far in this program, we've explored the impact that a clear vision and reaching across organizational boundaries can have on your facility's transition to value. We hope that in the past month, you've had an opportunity to reach out to other organizations to understand their perspective on population health, or to understand how they interact with your facility's patients when they're not in the hospital or clinic. Today, we're going to continue the conversation by looking at the role that communication plays in all the things we've talked about so far in this program: sharing a clear, compelling vision, reaching across boundaries, and ultimately successfully navigating the transition to value. We'll share some strategies for communicating across audiences and creating compelling messages. And we'll end by giving you a few things to discuss with your fellow board members and a few things you might consider doing between now and our next module. So let's get started. In earlier modules of this program, we talked about strong partnerships and a clear, compelling vision as key components of a successful transition to value-based care. We also mentioned that board members can contribute by convening community discussions and initiating connections with potential partners. In this module, we'd like to share with you some recommendations for effectively communicating with others and explore ways you might use these ideas to strengthen connections with community members and potential partners. The Center for Creative Leadership, a widely trusted source for leadership development, education, and research, offers 5 tips for communicating effectively. First, communicate relentlessly. Simplify and be direct. Listen and encourage input. Illustrate through stories, and affirm with actions. These recommendations are relevant for communicating no matter what the situation. However, because this program is focused on the transition to value, let's look at each of these tips in a little bit more detail by exploring ways that they might apply when communicating with community groups and potential partners about value-based care. Because different people absorb information in different ways, using a variety of delivery methods increases the odds of a message getting through to your intended audience. When it comes to spreading the word about your facility's vision related to value and population health, communication methods might include presentations to community organizations, articles in the local newspaper and on the hospital's website, individual emails to potential partners, brochures in patient areas, one-on-one conversations, and a variety of other methods. No matter how you're delivering the message, be sure to be consistent about the long-term vision. What will it look like when the organization has successfully made the transition to value, and what impact will it have on the community?
Well, I think communication is key to any type of change. To create change, you've got to create a vision that people can understand and see. They have to be able to see what you're trying to do. So I think articulating that in a way that makes sense to people. We talk here a lot about starting a communication with the why. Why are we doing what we're doing? And explaining that. But I think what's important too is to make sure that you understand who you're talking to and what's meaningful to them, so that you explain the why from the perspective of what's value to them. So what I might say to a physician with regard to why we're going to value is more related to the fact that their patients are going to be doing better, and it's going to be quality of care, because that's what physicians want to hear and that's what they understand. Whereas a payer might be more concerned about the cost equation and the fact that we're focusing on this because we're able to keep patients in a more cost-effective, delivering in a more cost-effective way. So I think you need to craft your message, so to speak, to the folks that you're talking to make sure that it's meaningful to them. So, you've got to start with that. Why are we doing it, and why is it important to you as a stakeholder? And that's where you get to the personal side of things, the meaningful piece of it.
If there's an employee that doesn't understand that crossing that shaky bridge on the journey towards value. It's really important to communicate why and the background, talking about all the concepts like the triple aim and everything else that is involved in bringing a higher quality experience to our patients, lowering the cost of health care. All of the reasons why these initiatives are important to the people that we serve. Communication is always a problem. At the root of every problem we have, it's probably communication. And there's plenty of times that I'll encourage people to have face-to-face conversations instead of through email or text messages, or even worse. So anytime that we can get people together to communicate face-to-face, I think we are more successful at being aligned together and engaged on projects that are important to our organization.
To ensure that your message comes through loud and clear, keep information limited to the most important points. The most important points, though, will be different for every audience. So here are a few things to consider when planning communication. First, what does the audience already know, and what do they still need to know? What 3 or 4 questions might they want answers to? Imagine, for example, that you're speaking with a behavioral health provider about a potential partnership with your hospital. It's likely that they already are aware of the relationship between behavioral health and chronic conditions, but they might be interested in hearing about potential ways that your facility might partner with them to improve outcomes for patients with chronic conditions. They would probably also be interested in knowing more about proposed workflows and billing arrangements. If you're speaking with a group of retirees at a senior center, however, many of them may not be aware of the impact that behavioral health challenges can have on chronic conditions, so they might benefit from learning more about the link between the two. They might also want to know what they might experience as a patient under a value-based model, whether interactions with their providers will change, and if they'll still be able to see the same people. Another thing to consider is your language. The audience won't be able to focus on your most important points if they don't understand the words you're using. Acronyms and medical jargon often don't mean much to a community group, so you'll want to avoid using these with some audiences. A group of providers, however, will not only understand this type of language, but may grasp the concepts of value-based care more fully if you use the same terms that they use in their everyday practice. And even if you're not the one delivering the message, you can still help those who are speaking on behalf of the hospital simplify and be direct with their communication. Because board members are often intimately familiar with different community groups, you'll likely have insights as to what the different groups already know and what they might want to learn more about. You can also provide guidance on the right language for the audience as well.
I think communication is critical to anything that you undertake. I think that communication, is largely responsible for successes and failures. I think that you have to tailor your message. You have to make sure that whoever you're speaking to, you're talking to them in a way that resonates with them. Business leaders might want to know, for example, how what we're doing is going to impact their cost. They might want to know how it's going to impact productivity. It will be a different conversation with our own team. We have to find varieties of ways to communicate, particularly in our community. So again, we have interpreters, we have community health workers. We created this year a digital strategy for the first time, and we have a fantastic director of marketing who was responsible for creating a whole marketing plan which included a digital strategy. So that allowed us to really make sure that people could access information in a different way that we had never had available to them before. So communication is key, whether it's internal or external, and we do make sure that we're constantly striving to communicate to take a multi-pronged approach to communication, because one person may learn better or hear better just by hearing a message. One person may want to read something. One person may need reminders from somebody that they're close to within the organization. So we try to impact the way that we communicate and the message that they receive, I guess, in a variety of ways.
when you're communicating a message to people, it's important to realize what audience you're delivering that message to. Whether it's a board member, a community, or technical staff within the facility, the same message may not be delivered quite the same. Complex topics like a hospital cost report, it may be helpful to explain to the community that maybe it's similar to your tax return statement. To the community or to the board members as well. But obviously your financial department would not appreciate that analogy. So tailoring a message to your audience ensures that it's received in the best way possible.
So far, in our exploration of communication, we've focused on the message delivery side. But as we all know, listening is often the most important part of an interaction. Listening provides a way for us to understand others' perspectives, hear concerns and questions, and check the accuracy of our assumptions about what an audience knows and what they still need to know. Whenever possible, build opportunities for gathering input from others into your interactions, and encourage your colleagues to do the same.
We are a very diverse ethnic community, not unlike any number of communities, and those are all changing and becoming more diverse over time. And so you have to have that engagement. I think a great example of that, our recent work with a task force during COVID that put together a lot of stakeholders on a I believe it was a weekly call. We kind of facilitated that with other healthcare providers and again, the city, the schools, other skilled nursing facilities, and any number of people. That helps establish you as your trusted resource. And okay, this is a time where we can talk about those things. And oddly enough, this surprised me, and I would have never thought about it. We became a trusted resource for our grocery store in town. As they went forward, we had a bit of a spike with the pandemic, and obviously in a small town, that's the one place where you're going to have a tremendous volume of people. Nearly the entire community is going to be going in and out, and they were looking for resources to, how do we protect our employees? How do we protect our patrons? And I think that was a good relationship, and I think that relationship bore fruit in controlling things that we could control to make things better.
As we noted in an earlier module in this series, stories give life to a vision or goal and can help people connect more fully to the message. One of the most impactful ways to talk about the transition to value is to share your own experiences with care, either as a patient or as a family member. If you've experienced smooth transitions of care and streamlined communication across providers, what impact did that have on your experience? And if you experienced the opposite, maybe communication barriers between providers or misaligned care plans, what impact did this have? While the language of the healthcare industry is often complex, almost all of us can understand the benefits and challenges of a value-based approach when we connect it with a real-life experience. Ensure that your behavior supports the message. As a board, you can affirm with actions by developing policies that support the transition to value, initiate partnerships with other organizations, and continually encourage people inside and outside the facility to change the way they think about healthcare.
It's absolutely essential to always have communication between everyone affected in every decision that you make. It's going to be extremely difficult for us to really get this value healthcare system working. And a lot of it's because of our demographics and our population. This is South Louisiana. People are not going to give up their beer and their cigarettes and their good food. It's difficult. We're an area which it's rural, but you're close to the major metropolitan areas. We're demographically roughly 50-50 white-black. But we're not transient. Everybody knows everybody. Everybody eats together. All we do here is eat and party. And it's difficult to tell somebody, you know, that fried pork chop or a sausage probably isn't the best thing for you to eat when you just got out of here with hypertension. It's hard. But, you know, it's going to be a slow process. And for that, we really need to work hard with the schools and then really do a follow-up in a really nice way, because you can't tell country people what to do. You got to make it be their idea, you know? People don't take orders well in South Louisiana. This is you doing this to make you better and yourself happier.
In our next module, we'll look at more keys to a successful transition to value, succession planning, and employee development. Between now and then, however, we'll ask you to consider these questions and share your responses to them at your next board meeting. How do you as board members view your role in communicating on behalf of the hospital? Are there any opportunities for doing more of this? How does your board currently communicate with other healthcare and community organizations? Which methods are most successful and why? How do you currently gather information and feedback from the community and bring it back to the hospital? What messages about your organization might you like more of the community to hear? And how might you tailor your messages to be as relevant as possible for each audience? And here's something you might consider doing before the next module. If you identified a potential partner after the last module in this series, think about ways to communicate in ways that would be meaningful to them. Think through your messaging with the new partner you identified for the Module 3 assignment. What do they know about your organization? What might they be interested in learning more about? And how might you tailor your messaging to connect with them? If you didn't have the opportunity to reach out to a new partner after the last module, learn more about potential entities that your organization might benefit by connecting with. Choose one of these organizations to contact and learn more about the services they provide. For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program by searching for Visionary Board Leadership within the Center's resource library. And as always, please feel free to contact us at the Center anytime for additional support. Thanks for joining us today. We look forward to continuing the conversation over the next few months.